Good morning. I'm Ashley James from Good Morning Maryland. I want to welcome you in to our monthly GBMC Facebook Live with our GBMC expert today. Our topic is hospitalists and hospital medicine. And when I asked people over the last week if they've ever heard of a hospitalist, most people have said no. So that's why we need to learn about it. So I'm joined by Dr. Chris Greenewalt from GBMC, the director of the GBMC Hospitalist Practice. Good morning, and thank you for being with us.
Good morning, Ashley. It is a pleasure to be back.
Yes, you were just right. You were just here not too long ago, and I watched that interview. It was really interesting. I learned a lot from it because a lot of times if you haven't stayed overnight, been a patient overnight at a hospital, or been a family member, maybe you don't know what a hospitalist is. So let me start by asking, what is it?
So first of all, the field of hospital medicine refers to the discipline or subspecialty within general internal medicine that focuses on the care and management of a hospitalized patient. And those folks are the most acutely ill. And so it just follows from that a hospitalist is a physician who is specially trained, usually board certified in general internal medicine, but has a special focus on the delivery of hospital care to very ill patients.
When we say to very ill patients, who are we talking about? So does everyone have that if they're staying overnight in the hospital?
Well, so the population I'm talking about are patients that have a condition such that it can't be managed as an outpatient. So perhaps just talk about bread and butter items of my world as a hospitalist, folks that maybe have a bad pneumonia with respiratory compromise, someone who's having a heart attack who needs to be monitored in the hospital, someone who may have had a stroke, diabetes exacerbations. These are conditions that would warrant someone being in the hospital for 1, 2, 3, maybe even 4 days. So this is the subset of patients that I'm talking about when I mention acutely ill patients. And they are the ones that need to be in the hospital as inpatients, and they are the ones that we are caring for.
What qualifications do hospitalists have?
Great question. As I mentioned earlier, most commonly a hospitalist is a physician, most commonly trained and certified in internal medicine. There is a little bit of variation to this. There is a secondary set of boards that are hospital medicine based that a practitioner like myself could sit for, but that's less common. And then going even a little bit further, some hospitalists in your community, whether it's Baltimore or elsewhere, may practice pediatric hospitalist medicine and surgical hospitalist medicine as well. So there's a smaller group, but by and large, it's a medical specialty, medical subspecialty. And in addition to just those basic qualifications, what the hospitalist is really qualified to do is navigate the hospital for the patient. So the hospitalist physician knows every square inch of the hospital, everyone who works there, the doctors, the nurses, the consultants, the medical techs, physical therapists, occupational therapists, speech therapists, and the list goes on. But the hospitalist knows how to manage all of those teams in coordination with the patient's care, very patient-centered.
I quickly want to say hello to some people who have jumped on Facebook saying hello to us. Terry, Stephen, Tom, Shelley, thank you so much for joining us. This is your time to ask your questions. We want this to be very interactive. We have Dr. Greenewalt with us, so let's pick his brain. Is this a new trend that we're hearing about in hospitals, or is this just something we're hearing more about now?
Another very appropriate question, and let me clarify. Hospital medicine in the United States has grown from changes in medicine over the last 30 years or so with different pressures to expedite care, interpret tests more quickly, as well as the fact that there's just so much more available in medicine. So years ago, there evolved a role for someone to be full-time in the hospital, managing patients and their care. And by 1996, one of the leaders of hospital medicine, Dr. Wachter out in California, actually coined the term hospitalist, and it has stuck. So 1996 was 22 years ago, so not that new. And the hospitalist movement, I'll talk about it at some point, but it has really exploded. And yet there's been a definite lag, I think, in the education piece to the average person who's going to encounter a hospitalist at some point but just doesn't know what it is yet.
Right.
That's why I'm here.
That's why you're here. Yeah, we have a great question coming in on Facebook. Is each patient assigned one, or do you have to ask for one?
That's a great question, and that also varies. Most typically, I can explain this from the purview of GBMC. We have a very well-established group. You mentioned 18 full-time physicians and a smaller subset of doctors who work part-time for us. But on any given day, we have 6 physicians making rounds on the patients that are already in the hospital, and then another subset of doctors who are admitting from the ER or perhaps from a doctor's office, et cetera. So we have a lot of folks working in the hospital every day from a larger pool of doctors. So sometimes some patients know one of us, maybe they know me or one of my colleagues, and when they are admitted, they say, is Dr. Greenawalt working? And so if someone asks for me and I'm working and my schedule fits, we absolutely try to oblige. But by and large, once someone comes in, we have an internal system of assigning patients based on the units to which they go and where their bed is located. And it works very well. It's very seamless. And we quickly get to know the patients.
Yeah. Another question that just came in on Facebook. English is not your first language. Do you have someone on staff who can help?
Very appropriate for today's world. And the answer is yes. We do have a couple. First of all, 1 or 2 of my partners speaks Russian, which there's a new need for, but also Spanish. A couple of my partners speak Spanish, and a lot of the staff do. So those issues are usually covered very well. And of course, we always have translator phones for some of the less common languages. So language barriers are a real problem, but one, it's a barrier that we are prepared to face. And I think that goes for most hospitals everywhere.
And talk a little again about just some of the specifics that you'll come in and do. Like you will order tests for patients. As a whole, you're managing their care, but what are you doing?
A lot.
You're doing everything, right?
A hospitalist is going to take care of the most basic things, such as the actual we used to write on paper, but now actually entering the admission orders into the computer, saying, admit Ashley to unit such and such, attending physician, Dr. Greenawalt, right? All those kind of basic orders, to also performing the diagnostic workup. So when a patient comes in and says, well, I'm having cough and fever, and we hone in on perhaps this is a pneumonia, and we'll order a chest x-ray, maybe even a CAT scan. So ordering the appropriate diagnostic tests. And then, after they're obtained, hopefully in a timely fashion, interpreting those tests, coming up with a treatment plan, kind of buffing out those orders a little bit more, and going from there.
Yeah, so just so I'm clear, you're still seeing other doctors as well while you're in there, correct? And so if a family member, let's say, has questions, who would they go to and how do they know the correct questions for each physician? Correct.
So when a patient is admitted to the hospital, whether it's GBMC or one of the other fine institutions, you may have a generalist like myself taking care of you, but maybe you need a nephrologist for your kidney, or a cardiologist for your heart issues, or a neurologist for a stroke or your brain issue. So you do have some subspecialists on board as well. The hospitalist coordinates that care. The hospitalist arranges for those consultations. The hospitalist takes that data and integrates it into the plan. So to your question about who the patient and their family should turn to, it should be me. It should be the hospitalist. The hospitalist should make several visits a day with the patient and the family or the assigned caregivers to explain and thoroughly communicate what is going on so the patients are in the loop.
I would imagine that most of the hospitalists, if not all of them, are very are great with people. Most doctors are, but there are doctors who maybe aren't as great with that. But a hospitalist, you're dealing so much with the family. I assume that you guys are all sort of people. Good with people.
I hope so. Again,
I'm going to say a people person.
Honing right in on some of the important skills. And as I mentioned, coordination of care and communication are so vital to what the hospitalists do. So being able to speak with people all day long is very integral to the job. So certainly when I'm interviewing someone to come on board, I'm paying a lot of attention during that interview moment to see how this person interacts with me and how they may do with a patient.
Well, it's so important to patients and their families, getting that extra care and getting someone to sit with you and getting that extra attention. That means so much to patients.
Ashley, let's face it, when you're told, myself included, when you have a problem that you have to go to the hospital and be evaluated, it's frightening, it's stressful, it interrupts your life. Mm-hmm. And now you have to be admitted to a doctor that you don't know, you've never met. that's a lot. That's
Yeah.
a lot for a person. And so the stress is real, and I think we are very aware of that. And as soon as we make that connection with the patient in the ER when they call to be admitted or when they're coming in from the outpatient side, I think the hospitalist physicians are very well in tune with trying to allay some of those fears and give the patients confidence that we care about them first and foremost. We care about working them up correctly, taking good care of them in the hospital, and coming up with a plan for the long term, how to deal with it.
That's great for people to hear. Another question coming in on Facebook, how many patients does each hospitalist have?
So this is variable from hospital system to hospital system. National averages for a hospitalist are somewhere around 15 inpatients a day. I can speak about my program at GBMC. We actually try to stay a little bit under that. So on average, we're seeing about 12 to 13 patients a day at the Greater Baltimore Medical Center. And the reason for that is that we are trying to deliver almost like a concierge level of care. We want to be very focused on that patient and have enough time during the workday and overnight, because we're 24/7, to explain everything and to treat them properly. So that's a really good question, because remember, everybody in that pool of patients is very sick, so they all need a lot of attention.
Carmen, Carly, hello. All of you joining us at home, hello, good morning. Again, feel free to write in your questions. We have Dr. Chris Greenewald here, the director of the GBMC Hospitalist Practice. Another question we had submitted, if I am readmitted to the hospital, will I see the same hospitalist or will it be different?
Well, we certainly try to make that happen. And this kind of goes back to our previous topic. If let's say a patient came back to the hospital within a week or two, and so the first admission was fairly fresh on everybody's mind, and that same doctor is still on schedule, absolutely, we're going to make that connection so that the patient already knows that doctor and that doctor already knows that patient, and whatever the reason is that they've come back, we can go from there and move forward. Again, due to complex schedules and perhaps the timing of when a patient comes back, we can't always make that happen. But this, again, highlights the essential communication piece. Between, if one of my partners is going to take care of somebody that I recently cared for, we're going to talk about it. We're going to make sure that patient is well attended to.
Comment coming in. Good morning. Best doctor I know. There you go. One of your patients out there.
Nice to hear.
What is the future of hospital medicine? Where do you see it going?
Well, I think the future is like that 80s song. I think the future is bright. If you look back over the last 20 years, the American Hospital Association started to actually monitor the number of hospitalists in the country. And in 2003, which was actually the year that I started at GBMC, it was reported that there were about 10,000 physicians practicing hospital medicine at that time. A similar study almost 15 years later, in 2016, reported that about 50,000 physicians were practicing hospital medicine at that time, which is a tremendous amount of growth. And I think that that reflects the fact that the role of the hospitalist was viewed as critical by the hospital systems and the patients as being vital. And so it just kept growing and growing, and I think it will continue. And things to look for in the future will be possible the expansion of the scope of work that hospitalists do. Some hospitalists are branching out into more critically ill patients, even more than what we see, like ICU level care, if they obtain the proper certification. Some hospitalists are shifting their focus to long-term care patients. So even some patients that may be in a nursing home or long-term care facility, there is a role for a hospitalist in that setting as well. And Ashley, if you'll let me also describe one other thing I think in the future, and I want to give a shout out to my colleagues in the advanced practitioner world. What I mean by that is there is a subset of hospital providers that are physician assistants and nurse practitioners who are accredited to deliver acute care in the hospital. And more at GBMC and elsewhere, we are seeing more and more of these advanced practitioners being able to care for hospitalized patients and doing a terrific job.
So let's say someone has you in the hospital, they were there for an extended stay, they're comfortable with you, they want to see you again, they get discharged. Can they make an appointment with you again, or are you in the hospital and they have to be in there to see you?
You know, the sad answer to that question is basically no, and I'll expound on that a little bit. By definition, the hospitalist or a hospitalist is a physician who takes care of someone only when they're in the walls of the hospital. And so after the discharge, we make very certain to hand deliver the patient back to their primary care provider. Now, oftentimes, after a patient is discharged, they have a question about one of their diagnoses, or perhaps a medication that was prescribed, or how do I get this test that you said I need as an outpatient? These questions come in, and our office manager takes these questions. And so I think it's also very important for the hospitalist to take time each day and go through their phone messages and answer questions via phone, which we do routinely.
So you could coordinate with somebody's primary care physician.
It's one of the essentials of hospital medicine.
Okay. So you're still kind of in their world, but just you're not seeing them.
We have to make sure that we not only take the time to do a great job while they're at our hospital or wherever, but to make sure that there is a real plan for transitioning them back out to the home setting and their usual doctor. And that takes a lot of coordination. And we help effectuate that using the help of our wonderful case managers and social workers. There are now transition care people in the community who actually can make home visits, all kinds of things that hospitalists are coordinating to keep those patients healthy once they leave us.
Gotcha. All right, we have another question that just came in on Facebook. Older relatives can be picky when it comes to their care. So would they be allowed to switch to another hospitalist if they wanted to?
Wow. Very pointed question. I don't know that it necessarily has to do anything with being older, but
right.
There are occasionally times where perhaps the assigned physician and a certain patient may not be a great fit. As a director, those kinds of issues will come to my attention as soon as need be, and if there needs to be a switch made, we can orchestrate that when needed. I would say that that isn't something that we strive to do. Certainly, I think the physician and the patient should try to come to an understanding as they get to know one another. But again, if we need to make an intervention, we can do it.
We can do that. Okay. Another viewer, this doctor is so handsome. That's what just written in.
I think my mom wrote that.
I don't think so. All right, so we have another question that was submitted earlier. How important is mental health care to your hospital, and what is the role of a hospitalist in the care of mental illness?
Ashley, this question, was submitted to me before the interview, and it really took it to heart right away because it's such an important question. And the reason why it's important is because mental illness very often leads to hospitalization. So by definition, a hospitalist really needs to make sure that they understand how to take care of somebody who's suffering with mental or psychiatric illness who also has concurrent medical illnesses. You have to be comfortable with that to give these people the same excellent care that everyone else deserves. So I can speak to what GBMC does. A couple of things. First of all, the hospitalist physicians are attending on patients with mental illness and again taking some extra steps to make sure we're delivering appropriate care. The hospital, our hospital, has also developed a specialized unit called the Integrative Care Unit, and on that unit they are specifically taking care of dual diagnoses patients that have psychiatric and medical problems, with a specialized team of nurses, aides, and techs, and care management people. So I think we do a great job at my hospital, but the broader issue is that hospitalists need to be just as well trained and well versed in the care of folks with mental illness. It's very, very important.
It's a huge issue. Another question that we had submitted is, what is the protocol for coordinating with a patient's primary care provider? And we talked about that a little bit, that is something you absolutely do.
I can go into a little more detail because this question actually was submitted by someone who was clearly, they had been frustrated by a perception of a lack of communication between the hospitalist physician and the outpatient doctor, and the author of the question felt that the care suffered because of it. We really don't like to hear things like that. I mentioned several times during the interview that communication and coordination are two of the absolute focal parts of hospital medicine, and so we must take the time to get the history from the primary care physicians and integrate that into the hospital records. A few years back, the GBMC executive team helped us, the hospitalist group, create an initiative whereby we were actually measuring each hospitalist's performance with contacting primary care physicians at the time of discharge. So each doctor every day had to record, Ms. Smith went from the hospital and I talked to Dr. Jones about her, check. And that data would be reported every day to the hospital executives. And it was very meaningful. It highlighted how we were succeeding and failing with this issue, because it's so important in my mind that the outpatient doctor is kept in the loop. And clearly this person highlights this.
For anyone who's just joining us, what's probably the main question that you get when you first walk into a patient's room?
Where's my regular doctor?
Right.
And then we sort of engage on a very brief version of this interview. But I think even though hospital medicine and hospitalists have been practicing here in Baltimore for 25 years, there is still a great kind of lack of understanding in the community. And this is kind of why I'm here today, is to make sure people understand who we are and what we do and why we're trying to make your care even better when you have to come in the hospital.
Okay, a couple more comments and questions on Facebook. Carly says, I'm learning so much that I didn't know. Thank you. This is good. A lot of people haven't heard of a hospitalist, don't know much about it, so we appreciate you coming on and talking about it. Another
Pleasure.
question that was just sent in to us on Facebook is, are you only a hospitalist, or do you practice as a regular doctor?
For me, when I only practice hospital medicine, I only practice as a hospitalist. And that was a decision that I made years ago when I was finishing my training. I just knew that I liked being in the hospital. The whole taking care of the sick patients, but being a part of what's going on in the hospital is near and dear to me. So that's all I do. It's enough. But there are providers out there that do a little bit of both. One of our part-time staff actually also works in a private practice, and he splits that time. So there are variations, but for me, I practice only in the hospital.
Okay. A lot of these people we're talking to out here on Facebook, we hope you don't become a patient in the hospital, but unfortunately it can happen, or it can happen to a family member. On the flip side, let's say somebody is interested in the field of medicine, and they want to maybe take the path that you have taken. Mm-hmm. How do they do that?
Great question. I was just reading the other day and I was very excited to read that more and more medical students are thinking of going into hospital medicine as their potential career. So essentially, as I mentioned early on, hospitalists are basically internal medicine physicians. So your board certification is in internal medicine, and you have gone through an internal medicine residency. So for the hopeful prospect in the field, it's, you go through medical school, 4 years, then you're going to go through your general internal medicine residency, which is at minimum 3 years. Some people will do a small fellowship in hospital medicine, but that's not required. But you basically track your training towards doing it. I'm always happy to host, it's not that I do this a lot, but I will sometimes have interested friends or family friends that want to see what I do and have them shadow me for a day and just take a look at it, because it's very, very worthwhile.
I'm sure it's very rewarding. We want to thank you for all that you do, and thank you for being with us today.
This was a lot of fun.
Again, Dr. Chris Greenewalt, Director of the GBMC Hospitalist Practice. Is there a place that we can go to learn more about the program?
Well, on the website, www.gbmc.org, there is a small page that you can navigate to that has our names and our photos and some of our bios and things like that.
Okay, great. All right, well, thank you so much for being here.
Thank you, Ashley.
And thank you for joining the conversation. We hope to see you next month here for our GBMC Facebook Live here at WMAR. Have a great day.
Bye.